Today is my first real day of clerkships. For the past month, I've been doing what my school calls a transitional clerkship, where it's basically like a boot camp to get us ready for the real thing. We did a lot of review of high yield topics, like how to read an EKG, how to read a chest x-ray, learn some different kinds of physical exam stuff. But today marks the real deal. I start my internal medicine rotation today. It's gonna be 8 weeks long, and I am super excited to just get out into the hospital and start seeing real patients. So today isn't super exciting, it's mostly just an orientation. This morning is just a few virtual lectures telling us how everything is gonna work. We have a few sessions with our clerkship director and a few other physicians. It's like 8 to 12, so not too bad. Then after that, we're supposed to go to our individual hospital sites to meet our preceptor, get a little bit of a tour, just get our bearings before we really start tomorrow. So like I said, our lectures are kind of just orientation kind of stuff, especially the first one. It's literally called orientation. Then we've got, I think, an hour and a half of something called illness scripts that is just talking us through the process of sort of pattern recognition and learning how diseases typically present. Obviously things can present differently, but you have to have sort of a framework where, you know, once you compile a few different symptoms and labs and stuff, you kind of have an idea of what the possible diagnosis is. So I think that'll be a super helpful session. And then our last one is basically telling us how to hand off a patient, which is a super important skill. As a doctor, a resident, a med student, you can't be there 24/7. You're not caring for the patient for the whole hospital stay. So you have to have a good system of handing off your patient to the night team, and then also in the morning hearing what happened, any updates, just to make sure everyone's on the same page, because when you have that sort of handoff, there can be some miscommunication, which can lead to mistakes. So it is a really important skill and stuff that we're going to be doing starting tomorrow, so I'm glad that we're getting that session. All right, so bit of a change in plans. I just lost power. I think the whole area went out. I mean, I don't have any power, no Wi-Fi, nothing. So I have to go to a Starbucks in the town over to keep doing my Zoom lecture. It cut out like halfway through one of my lectures, and I just threw on the hotspot on my phone so I could at least finish that lecture, and thankfully we have a little bit of a break right now. So I'm going to drive, hope that that Starbucks is not in the same area, so they actually have power and Wi-Fi, so I can finish out my lectures for the day. And then after that, going to head to the hospital for the tour. Alright, so I just got back from my first real day in the hospital. Yesterday on the tour, I met one of the PGY2s who is on the team that I am on, but she is studying for one of her board exams right now, so she was just like, hey, here's the intern's number, like, text him about when and where to be here today. So I was told to get there at 7 this morning and just go to the library, and I went to one of the libraries that I saw yesterday, but it wasn't the right one. There's like 5 or 6 different main locations in the hospital that I'm in, so I was in Ackerman, but I was supposed to be in Booker. So I made my way to the Booker Library, and I recognized it because I did briefly go there yesterday to get like our meal cards. The big main library where a lot of people just kind of like hang out, study. There's a student lounge there. I met up with the intern. He just gave me a little bit of a spiel about him, what the team is going to be like, because I'm actually on sort of a special team. It's Team A, which is the admission team. So we don't really longitudinally care after sort of a group of patients. We are in charge of doing all of the admissions and then also responding to all of the rapids and the codes. Pretty different from what I was expecting and different from stuff that I'm going to be doing in a few weeks. I'm only on this team for a week. Anyway, like I said, got there, met him, and basically just studied for a little bit. He was explaining that the admission team is a sort of an academically focused team. Obviously, if there's rapids and codes, you have to go to them, and admissions, we're in charge of that. But
other than those events, you're kind of just studying the whole time. She said that it's a good time for the interns or residents to study for their board exams. Like I said, the PGY2 is studying for a board. Another one of the interns studying for step 3, so it seems to be more of a relaxed team. This morning, I think we responded to like 1 or 2 rapids, so nothing that crazy. We had a good amount of time to study in the library. And then also every day from 10 to 12 is protected academic time. So if there is a rapid or a code, it goes to a different team. And usually we'll have some sort of lecture by a resident or an attending. So today was pretty informal. It was just one of the PGY3s, me, the other student that's on my team, and both of the interns. So the PGY3 was just like, all right guys, like, what do you want to talk about? It wasn't like a formal presentation. We basically just came up with topics and he talked through them. He is super smart, so we asked to learn a little bit more about when to use what antibiotic for what bug. You know, this is stuff that we have learned in the past, but taking a test on that is very different than what you do in real life. That was a huge topic that we covered. And then as soon as 12 hit, kind of all hell broke loose. And they said that that is usually how it works is, you know, after that protected academic time, it gets really busy for the rest of the afternoon with doing admissions, responding to codes. I think there was probably like 2 or 3 codes we respond to, another like 3 or 4 admissions we had to do. Because, you know, you got to think, if someone is coming into the ER in the morning, the ER team is going to do their initial workup. Then they're going to call the PGY3 on our team, sort of talk about, hey, got this patient, this is what's going on, this is what some of the initial tests showed, like, do you think we need to admit this patient? And if they determine that yes, this is someone that we should admit, the PGY3 texts the interns, hey, there's someone in the ER, go see them. So all of that is happening in the morning, and then it kind of builds up, and then in the afternoon is when all of the admissions actually happen. So like I said, the afternoon was kind of crazy. We were just running around the whole time. As soon as we were done with a rapid, there was a new admission, and you know, we would be halfway through an admission and we had have to go to a code. So kind of a weird juxtaposition. The morning was very, very chill, and then the afternoon was kind of crazy, but I liked it. There was never really a dull moment. So yeah, all in all, pretty good day. Today was really just like shadowing. I didn't see any patients on my own, which makes sense. I can't really do anything in a rapid or a code, and definitely going to take me a few times to see the interns interacting with the patient in the ER or whatever, learning what is important for an admission, and honestly just like navigating the hospital. I would have gotten completely lost if I wasn't just following the interns. But yeah, that is pretty much it. I will check in after my shift tomorrow. Alright, I just got back from the hospital after my second day. It is Wednesday afternoon. Today was pretty similar to yesterday. Got there, studied a lot, responded to a few rapids, a few admissions, then had our protected academic time from 10 to 12. Today it was with a attending actually, but still very informal, just like walked in, hey guys, like, what do you want to talk about today? What do you want to learn? So we talked about acute kidney injury, because that is a huge topic. There's so many patients in the hospital that have kidney injuries, so definitely wanted to brush up on that, know how to work it up, how to treat it, how to figure out like what the cause is, because there's a bunch of different causes. So we talked about that for a little, and then also just like asked him for general advice on how to be successful as a medical student and an intern. So really good advice. I really like this team, and I'm learning so much just because of this protected academic time. You know, I'm sure I'm gonna be learning so much when I'm more intimately involved in patient care and, you know, following a patient and you know, seeing how the plan is evolving. But for right now, I think this is a great team to start on, just because internal medicine is so complex. It's essentially covering like 90% of what we learned in preclinical. So having a lot of study time to brush up on stuff, you know, get ahead on UWorld, rewatch some of the videos that I've been watching over the past year and a half. It's been really helpful. So that was the morning, and then in the afternoon, there was another lecture from 12 to 1 that we got to stay for a little bit of, but then we got called to a code, so we had to respond to that. And by the time we came back, it was kind of over. Then there was a few admissions in the ED. One of the patients was an interesting case. So she had like this progressive right leg weakness since Thanksgiving. So over the past few weeks, it just got progressively worse and worse and worse, and now she can barely move it. We were trying to do a physical exam, and her left leg was fine, but her right leg, it definitely wasn't moving against resistance, and it was really barely moving at all. So the one interesting thing was the patient had a history of MS. So at first we were like, oh, this is like an MS flare. But after talking to her a little bit, this really isn't how her MS flares ever present. And it was sort of hard to nail down the history, but it seemed like she suffers from sciatica too, because she said that she would get these injections in her back for back pain, which, could be an epidural injection into her back for sciatica, which is a pretty common treatment. And she was currently experiencing back pain, but sciatica typically doesn't present with complete motor loss in like all areas of your leg. So yeah, that was pretty interesting. I'm definitely going to follow that case to see what ends up happening. We call it a neurology consult just because they're a lot better equipped to sort of determine if this is MS related versus like maybe some traumatic thing going on with the spinal cord. So yeah, that was a pretty interesting case. There's another one in the ED where there's this 20-year-old came in after a car accident, was pretty much hit head on. Miraculous that they weren't more injured, because they really, they were a little bit bruised up, but didn't break anything, didn't have a headache. Like, they felt completely fine, which is insane. But the reason we were trying to work them up and admit them was they had some very clear ST elevations on their EKG, but it's just kind of odd because they're like in their early 20s. So like I said, the patient felt completely fine, no chest pain, no palpitations, no shortness of breath, nothing like that. So they were a little bit reluctant to stay just because they're like, I need to figure out my car situation, I need to go to work, all that stuff, which is totally understandable. But we were just like, hey, your EKG was pretty concerning, so we would like you to stay for a few more tests. And when we initially saw them, they were pretty distraught, kind of all over the place. It was a little bit overwhelming because it was the intern and then me and another student, so we had this sort of team talking to them. So we left, and then just my intern went back to talk to them to see what they were thinking after they were able to digest it a little bit. And they ended up wanting to stay. I think the plan was to do an echo on them just to rule out any sort of like serious cardiac abnormality. But yeah, two interesting cases. Tomorrow is going to be a little bit different. We have lecture from 1 to I think 5:30 tomorrow. So even in your rotations, you're still going to have lecture, which I knew coming into this, but I didn't know it was going to be quite that much. Usually they try to stack them all on the same day, especially I know like I think peds is always on a Tuesday. They tried to do Thursday for IM, which tomorrow is a lot of lectures. I think we have like 4, but next week it's like 1 a day. I think Monday through Thursday has like 1 lecture in the afternoon. So it is what it is. I know that they have to work around everyone's schedules, and the doctors are really busy, but we're learning about a lot of really important topics, so it'll be good. Learning about diabetes, how to read a chest x-ray, pneumonia, so very common things that we have to know super well. But yeah, tomorrow shouldn't be too bad, because as soon as things usually get crazy in the afternoon, we'll have to leave and go to our lectures. So tomorrow should be a pretty chill day.
Alright, so it is Friday. Got back from the hospital not too long ago, and it is just crazy that I'm already done with my first week. It flew by. Only have 7 more left until I move on to surgery. All in all, it was a great week, great day. I actually got to see my first patient alone. My interns just kind of wanted to ease me into things. They didn't want me to take on too much on my plate, which I appreciated. And this team was hard to see patients alone. As I mentioned, I'm on the admission team, so there's not like a patient that I'm necessarily following for their whole hospital stay, which is like what a lot of other internal medicine teams will be like. So, obviously when we're responding to a rapid or a code, I can't really do anything. I just kind of stay out of the way, listen, see what's going on, ask my intern questions when it's appropriate. But in terms of actually interacting with patients, I can't really do that during those just because it's a really high stress situation. You know, people who actually know what they're doing have to be in charge and doing everything. So that only leaves admissions to where I have a chance to interact with a patient one-on-one. And after seeing a few of those between Wednesday and Thursday, I felt comfortable doing one without the intern. So me and my classmate, who's also on the team, went and saw the patient together. We didn't get too much information beforehand. We could have looked through the chart kind of extensively, but we wanted to kind of just go in there and get as much information as we could. We did know the chief complaint, but other than that, we just wanted to take like sort of a fresh history and physical. The patient was in the ER, so the ER team had done some stuff already and we got some tests back, but there was still a lot of stuff that was pending. So we kind of had to tell the family the results of the tests that had already come back, but you know, we still need to wait for these other tests to come back before we can sort of take the next step and have a better idea of what's going on. And I cannot tell you how refreshing it is to talk to real patients. You know, for this past year and a half, we've pretty much only been talking to actors, where it is pretty hard to fake the empathy. You know that you're just being examined by them. You know, as soon as you walk out of the room with an SP, they fill out an eval, which that's not necessarily going to happen with a real patient. So you can just be more relaxed and more like present and just worry about actually taking care of them. So interacting with that patient, talking to family was great. It was probably the highlight of my week. And I'm interested to see what ends up happening. Obviously we were just the admission team, so we just kind of passed them off to one of the medicine teams and we didn't really get to follow up. But you know, the good thing about Epic is I can just kind of follow all the patients that we saw this week to see, you know, what ended up happening, did they get discharged, all that kind of stuff. So that's another really good thing about taking care of actual patients is, you know, you get to see them throughout their whole course and hopefully see them get better. So that's about it for right now. I am actually going to the hospital tomorrow morning, but I will talk about that later. Alright, so it is Saturday afternoon. Just got home a little bit ago and have been doing some studying. So this morning I got up and went into the hospital at the normal time, around 7. On internal medicine, our clerkship director really wants us to go in at least one morning of the weekend because that's pretty normal for an internal medicine physician, especially if you're a resident. So she kind of wants us to get an idea of what it's like being an IM doctor. I had a little bit of experience with this already because my LCP was an internal medicine doctor who mostly did outpatient primary care, but I think every like 5th or 6th weekend she was on call in the hospital. So, you know, she would go in the morning, look after all the patients that were admitted, then go home once everything was done. So I kind of knew that that was the workflow, but the main reason I wanted to go in was because I'm transitioning off of the admission team to a different team next week, and it's going to be very different from the admission team. It's going to be more like a traditional internal medicine team where, you know, I'm going to go in the morning, pre-round on whatever patients I am assigned to, then prepare sort of a plan and presentation, go to rounds, present my patient, talk with the intern and the resident and the attending about what we want to do with them. Then the rest of the day sort of follow up on all that stuff. If we're getting more tests, make sure, you know, I see them when they come back, sort of update my attending on what's going on. So very different from the admission team where I'm just kind of like, sort of different from the admission team where I'm not really following a patient. We're just sort of responding to emergencies and then putting a new admit on a different team. So the intern that I worked with this week was actually covering for team C, which is the team that I'm gonna be on next week. So I was like, oh, this is a perfect opportunity to go in, meet some of the patients on the team, see what patients I might want to follow, and then also just see his workflow of pre-rounding, putting together a plan, and then presenting it to the attending, because I didn't see any of that this past week. So like I said, got there around 7. He was already there and had seen a few patients, but I went and saw like 2 or 3 patients with him. Then we went to rounds, which were pretty informal, I think just because it was the weekend, there wasn't that many people there, but I did get to meet the attending that I'll be working with this next week, so that was great. He was super nice, and yeah, just had a good time. Was a good change of pace from what I was doing this past week, and it does get me excited for this upcoming week, and being a little bit more involved in a patient's care plan. So I was done at the hospital around 10. went and did a quick workout, and then I actually went back to my old apartment up in North Jersey to sort of grab the rest of my stuff, turn in my keys, all that. So been a long day and haven't really gotten any studying done, but it is what it is. And, you know, it's something that I had to do, and at least I can cross that off my list. So as I mentioned, I will be transitioning to a different team this week. Seems like that will happen a lot, and that's just how things go. You know, the attendings switch pretty much every week. The residents are on teams for maybe like 3 or 4 weeks at a time, but the students kind of switch every week as well. So we'll be working with a lot of different people. Every one of the internal medicine residents and attendings has been awesome, so not really worried about that. But the rest of the weekend, I'm just gonna have to catch up on a lot of UWorld, a lot of studying, because, you know, I found that this week I forgot a lot of what we learned over the past year. You know, things will get mentioned, I'm like, oh yeah, I kind of remember that, but I definitely have to go through a lot of the topics that we covered over my preclinical years, a lot of cardiology, nephrology, pulmonology, GI is huge, so. But it's good. I mean, I've already seen the benefits of caring for patients in real life and seeing these diseases firsthand and how it makes it stick a lot better. There's been a few UWorld questions these past few days where the only reason I got it right was because of a patient we saw this week. So it was nice to see the pieces start to come together. All right, well, that is going to do it for today's video. If you enjoyed, please be sure to leave a like below and subscribe if you want to see videos like this in the future. Thanks, and I'll see you in the next one.